Assalamualaikum warahmatullahi wabarakatuh. Thank you for the time given to present my manuscript at the third conference on community empowerment for health journal, Faculty of Medicine, Public Health Nursing, University of Gajah Mada, Yogyakarta. In the first time, I will introduce myself to all audience. I am Faisal Ibnu from Stikes Binasiat PPNI Mojokerto, and I am graduate of the doctoral nursing program in University of Indonesia, and I am a community nurse specialist. On this occasion, I will present about my research with title Effectiveness of Family Mentoring Model to Decrease Blood Pressure of Hypertensive Client in the Working Area of Mojokerto District Health Center. The background of this research hypertension is the most common disease and usually arises without complaint. So many clients don't know that they have suffered from hypertension. Until now, hypertension is still a major problem and is the first cause of deaths in the world. The method in this research design use quasi-experiment, non-randomized control group, pre-test, post-test design. The samples, it's about 120 hypertensive clients using purposive sampling. Model intervention are given for 8 weeks and home visit are made 1 a week. Data analysis using independent and dependent t-tests. The model intervention in this research, the first time I give for 8 weeks and home visit are made once a week. This research starts by the beginning of the first week by doing blood pressure measurement of pretest. And then I did mentoring by giving health education by leaflets, hypertension flyer, and workbooks until 4 weeks. And then week 4 to the week 8, self-learning. And finally, measuring post-test blood pressure. The result of this research show that the model intervention effectively lower the blood pressure of hypertensive clients. This was indicated by a systolic blood pressure decrease and diastolic blood pressure show a significant decrease after model intervention. The discussed in this research intervention model for 8 weeks through the learning process with mentoring, namely through the provision of health education, mentoring by providing leaflet and flyer hypertension, and home visit once a week is able to lower blood pressure, systolic and diastolic hypertension client. This following the research of Hamilton et al. In 2017 explained that the head coaching management provided to hypertensive client patient can increase client knowledge of hypertension and be able to reduce blood pressure, but systole and diastole. This is also by the result of research by Marcianti and Praningsih at 2019, which show the family assistant for 1 month and assisting every week can reduce the client blood pressure. In the end of the research, conclusion. Intervention model mentoring family effectively lowers the blood pressure of hypertensive client, but systolic blood pressure and diastolic blood pressure. Thank you very much for your great attention, ladies and gentlemen, and good afternoon. Wassalamualaikum warahmatullahi wabarakatuh.